Malaria is the third leading cause of death for children under 5 years worldwide, after pneumonia and diarrhea. As the global community marked World Malaria Day on Tuesday, a non-governmental organization, Child Health Advocacy Initiative, staged a rally in Lagos to sensitize members of the public on how to tackle the disease. Joseph Oko reports.
According to the latest data from the World Health Organization, nearly half of the world's population is at risk of malaria. In 2015, there were roughly 212 million malaria cases and an estimated 429,000 malaria deaths. Also that year, sub-Saharan Africa was home to 90% of malaria cases and 92% of malaria deaths. More than 70% of all malaria deaths occur in children under the age of 5. An estimated 100 million malaria cases and about 300,000 deaths each year make Nigeria the country with the highest number of malaria casualties worldwide. It is no surprise, therefore, that the Child Health Advocacy Initiative, CHAI, staged a rally around the streets of Shomolu local government to raise awareness and provoke action in eliminating the disease. Residents were enlightened on how to prevent, detect, and treat the disease. Despite some gains in malaria prevention and treatment over the years, the organizer of the program, Lola Alonge, said there shouldn't be any room for complacency.
We have a statistics which shows that 11% of maternal deaths is caused by malaria. It also shows that about 25% of infant mortality is caused by malaria. 30% of under 5 deaths is caused by malaria. This is preventable, and that is why we feel we should put an end to it by raising awareness and actually also interventions like distributing the insecticide internet for them to use. We're also doing things like residual spraying so that we know that we try to make sure that we keep the environment clean.
Alonge also believes an all-inclusive anti-malaria campaign and pragmatic approach will help tackle the scourge faster.
We've actually gotten their contacts and we intend to continue to follow up on them. So we are tracking them. Like I said, they are going to be advocates. We're not just going to leave them after today. We're going to check them from time to time. What are you doing? Have you even used it? Have you spoken to someone else to use it? What are you doing? Are you keeping your environment clean? So it's not just going to be a one-time thing. We're going to make sure it's continuous.
Insecticide-treated nets were distributed to participants, including pregnant women and nursing mothers. A gesture which drew appreciation and delight from beneficiaries.
I'm going to use it by hanging it on my bed and use it to cover myself, and it's one so that if I can try to, maybe next time if you brought this up, my children too will be able to use it, so we won't feel any malaria again, like mosquito malarias and every other thing.
First time we have something like this in our houses, and we appreciate it that because we have a lot of kids in our area, and what we have in this area, because we have a big gutter, and the problem that we have here is malaria. So it's a very appreciated program.
We'll be working. I think before we sleep now, we organize it and put it on our bed or wherever, so that the mosquito can never have a chance to come in again.
Before, I don't used to use this thing because I don't used to use it. But before now, I will try to be using it because it's good.
April 25 is celebrated globally as World Malaria Day, an occasion to highlight the need for continued investment and sustained political commitment for malaria prevention and control. The theme of the rally was Malaria to Zero. Joseph Oko, Galaxy News, Lagos.
Away from health matters